Hello and welcome to Hooray. Now we are going to learn about the speaking subtest in the occupational English test. Let's look at the test format. Total time for the speaking subtest is 20 minutes. You will talk to the interlocutor for 5 minutes. You have 2 to 3 minutes to prepare for your role play. There will be 2 role plays specific to your healthcare profession. The session is recorded and the scoring will be done by 2 different examiners. You will have a face-to-face examination between the interlocutor and you. The topics will be specific to your profession. Here's how the speaking is assessed in the updated OET 2.0. The total marks will be on 39, where there are 4 criteria covered under language, which is called linguistic criteria. And there will be 5 criteria under clinical communication criteria. Under linguistic criteria, you have intelligibility, fluency, appropriateness of language, and resource of grammar and expression. All these carry 6 marks each. Under clinical communication criteria, you have relationship building, understanding and incorporating the patient's perspective, providing structure, information gathering, and information giving. Each carries 3 marks. So for linguistic criteria, it totals to 24, and clinical communication criteria list adds up to 15. So 24 plus 15 is 39. Whatever score you carry will be divided by 39 and will be multiplied into 500. That will give you your speaking score. Thereby you will understand your grade. Let's look at the description of the questions. First, you will have a warm-up session which is not scored. Then you will be given 1 role play card at a time. You will totally have 2 role play cards. You will not be given the interlocutor's role play card. The interlocutor's card will include information that is not included in your role play card. The card gives you a good idea of the outline of the conversation. The role play cards will inform you of the key details about the patient. It will also give you the reasons for their appointment. Take all of these pieces of information into consideration and plan your approach accordingly. Let's look at the strategies for the speaking subtest. It tests the real patient scenario. It establishes a relationship, asks for relevant information, and you need to use varied vocabulary. This test tests your communication skills in English and not your medical knowledge. Analyzes different types of information. You need to clarify your doubts before starting to speak during the 3 minutes of preparation time. Don't memorize long answers. You have to be good at pronunciation, fluency, and intonation. It includes all information, especially bullet points. Make notes while you have time to prepare and mind the context. Underline the keywords and phrases. Use good intonation and voice modulation. Use ideas and examples in full sentences. Be confident, smile, and make eye contact while you speak. Let's look at some techniques. Identify who is the patient, what type of patient you're dealing with. Look for the emotions of the patient and plan your approach accordingly. See what you need to find out. Identify the questions that you need to ask. Rephrase the task into appropriate questions. Ask open-ended questions first and then close-ended questions. See what you need to tell the patient. Provide your patient with necessary information about their condition, tests, and course of treatment. Tailor your response. Speak in English. Communicate confidently. Take control of the interaction. Lead the topic of conversation. Avoid memorizing. Speak fluently. And avoid overusing filler noises like etc. Look at relationship building. Ask permission for uncomfortable topics. Do not devalue or criticize. Show empathy towards the patient. Elicit and explore the patient's concerns. Pick up on patient's cues and react accordingly. With this, we come to the end of the speaking subtest in OET. Thank you and all the best.